So good morning, and thank you for being here today. My name is Dr. Susan Phillip. I'm the health officer for the City and County of San Francisco, and I'm the director of the Population Health Division here at the San Francisco Department of Public Health. I'm joined today by my colleagues, Dr. George Chahine, who is a Communicable Disease Director at the San Francisco Department of Public Health, as well as Dr. Antonio Chahine, also with the department, who has specialties in pediatrics and preventive medicine. We're so happy to be with you all today to talk about the importance of vaccinations for COVID, flu, and respiratory syncytial virus, or RSV. While COVID, flu, and RSV activity is currently low in San Francisco, it's important to get vaccinated. We are early in the respiratory virus season, and now is the time to protect yourselves and your families, to prevent yourselves from getting seriously sick and needing to go to the hospital. And getting vaccinated is especially important before the holiday gatherings start to begin. So this fall for COVID, there is an updated COVID vaccine that everyone should get to protect themselves from the latest COVID strains that are circulating in the community and to protect their health. Even if you've had the COVID vaccine last year, everyone is recommended who's 6 months old and up to get a dose of the updated vaccine. Getting the vaccine every fall with the new updated formulation is the best way to protect yourselves and those around you, including your loved ones, from severe illness, hospitalization, and death from COVID-19. The updated vaccines are widely available at health systems, at pharmacies and clinics, and again, recommended for everyone 6 months and older. Getting vaccinated is especially important if you're 65 or older or have underlying medical conditions, again, to prevent the chances of severe illness or death. And it's also important for everyone in the public to be aware that there are free COVID tests that are available to them by the federal government. Every household can order up to 4 free COVID tests and have them delivered to their residents through the mail. Testing for COVID will help you determine what to do to reduce risk of severe illness, such as seeking effective treatment, such as Paxlovid. So visit covidtest.gov to order your free tests. I'm going to switch a moment to talk about flu. The flu vaccine is also strongly recommended for everyone, also for 6 months and older. CDC preliminary estimates are that during the 2023 to 2024 flu season, flu vaccination prevented between 7.3 million and 15 million symptomatic flu illnesses. Getting vaccinated is especially important for people, again, who are at higher risk of developing serious flu complications, such as people age 65 and older, people with certain chronic medical conditions, such as asthma or diabetes, and people who are pregnant. It is safe to get the COVID and the flu vaccines at the same time. I will now turn things over to Dr. George Chahine, who will discuss RSV vaccine.
Thank you, Dr. Phillip. So RSV, or respiratory syncytial virus, is another virus that often causes colds, but can cause pneumonia and other lung infections, especially in people who are more vulnerable, and we'll talk about that. So there are several groups who should get the RSV vaccine. All adults aged 75 years and older are strongly recommended to get the RSV vaccine this fall. And adults who are between the ages of 60 and 74 who have a condition that makes them more likely to get severe RSV, such as heart, lung, liver, or kidney disease, diabetes, obesity, or weakened immune system, or living in a nursing home or other long-term care facility, are also strongly recommended to get the RSV vaccine this fall. In addition, babies, especially children under 2 years of age, can get very sick from RSV. And so the way to protect babies is actually to vaccinate the pregnant parent. And so people who are in weeks 32 to 36 of pregnancy are strongly recommended to get the RSV vaccine. And that is so that they produce antibodies that can be passed on to their babies that can then protect the baby from RSV during this time when RSV tends to circulate, which is during the winter months. If you have received the RSV vaccine last year, you do not have to get it again, as you are already protected. And RSV vaccines are covered by insurance, and it's safe to get RSV vaccine at the same time as COVID and flu vaccine. And so one last word about people who are pregnant. So all 3 vaccines, COVID-19, flu vaccine, and RSV vaccine are recommended for pregnancy to protect the health of both the pregnant person and the baby. And now I'd like to talk a little bit about access and where people can get these vaccines. As you may have heard, the federal government has ended their program of providing free COVID shots broadly to the public, but both COVID and flu shots are still widely available. If you have insurance, you can find the updated COVID and flu vaccines at a pharmacy near you by visiting vaccines.gov, or you can contact your healthcare provider. If you do not have insurance, there are several options. One is you can enroll in Medi-Cal, California's Medicaid program. So the good news is in 2024, California implemented an expansion of the Medi-Cal program, which makes it easier for low-income individuals and families to sign up regardless of immigration status. In addition, the San Francisco Department of Public Health also operates Healthy SF, which is a program that is designed to expand the safety net and which makes health services available for more San Franciscans. And so the way you can access these is you can go to sf.gov/vax to learn more about vaccine options. And now I will pass it over to Dr. Antonio Chahine, who will share a few words in Spanish.
Buenos días. Muchas gracias. Buenos días, muchas gracias por venir. Estoy aquí con el Departamento de Salud para darle un recordatorio que en esta fecha que estamos aproximándonos ya a las fechas festivas, es importante vacunarse contra los virus respiratorios. Se incluye el COVID, el virus de la influenza y el virus sincicial respiratorio. Quiero dar un recordatorio que en este año ya tenemos la vacuna actualizada del COVID-19. La vacuna cubre del año 2024 al 2025 y protege contra las cepas más recientes que están circulando en nuestra comunidad. Quiero recordarle a los ciudadanos de San Francisco que si se vacunaron el año pasado, tienen que volverse a vacunar este año porque tenemos una vacuna actualizada, que es segura y actualizada para cubrir contra el COVID de este año. Quiero también recordarles que vacunarse es la forma más efectiva que tenemos para protegerse de hospitalizaciones, de enfermedades graves y hasta muerte a causa de estos virus respiratorios. La vacuna del COVID-19 está disponible en nuestros sistemas de salud, está disponible en las farmacias y también está disponible en sus clínicas comunitarias. También quiero recordarle que recomendamos a todo el mundo mayor de 6 meses para vacunarse, especialmente personas mayores de 65 años que están a más riesgo de enfermedades y síntomas más graves a causa de este virus. También este año tenemos la vacuna contra la influenza actualizada, ¿verdad? Para este otoño. Recomendamos a todo el mundo mayor de 6 meses y como también COVID a personas mayores de 65 años para vacunarse. Eso lo protege de síntomas graves y hospitalizaciones. También quería tomar esta oportunidad para hablar un poquito sobre el virus sincicial respiratorio. Ese virus es un virus que afecta a toda la población, tiende a ser más severo a los niños menores de 2 años y a las personas mayores de 75 años y a personas que tienen condiciones crónicas como el asma, la diabetes o un sistema inmunológico debilitado. Recomendamos vacunación para ese virus. La recomendación es personas de mayores de 75 años o personas entre 60 años y 74 años que tienen algún tipo de condición crónica, como la que había comentado previamente. Para proteger a los niños pequeños, recomendamos la vacunación a las madres embarazadas. Normalmente se habla de vacunar a las madres en un cuadro de 32 a 36 semanas de embarazo. En ese plazo se recomienda la vacunación para darle protección a los niños pequeños. Quiero recordarle que las vacunas son seguras y puede tener más información sobre las vacunas en nuestra página de internet, que es sf.gov/v-AX. Ahí tiene más información sobre las vacunas. Muchas gracias.
Any questions? Oh.
I actually do have a question. Reading down the list of things, wearing a mask. We can talk about holidays. How do you feel about, what kind of mask to wear? I know that there have been questions about that. I see people wearing all different kinds.
We'll have
Yeah.
Dr. Han
Fantastic.
answer some of these questions.
Thank you so much. And if you could turn it towards you. Yeah, that way.
Thank you for the question. So the question is about masks and what kind of masks are best. The highest quality masks are recommended, and those are masks such as N95s, KN95s, or KF94s. Those provide the most protection against these respiratory viruses such as COVID-19 and influenza. You can also wear surgical masks. They do provide some protection, although a little bit less, and so that's why, if you can, we do recommend the higher quality masks.
There's something that you mentioned earlier about how here in the Bay Area you're seeing low COVID numbers, but as we all travel during the holiday, are there places outside of this area that you might be concerned with? Certain states, certain pockets where you're looking at?
So this is a great question about travel and what you might expect to encounter, or where there might be places that have increased risk of encountering respiratory viruses such as COVID or flu. I think the challenge we have with respiratory virus season and COVID and flu in particular is that they do tend to be unpredictable. We know that they tend to rise during this fall to winter season, which is why we're talking about getting your COVID and flu vaccines today, because if you haven't already, now is a great time to get it before the holidays hit. The thing that happens, as you know, during the holidays is that lots of people travel, gather with family and friends, and so because of that mixing and mingling, that tends to be a period when these respiratory viruses increase. And so we recommend that rather than try to keep track of every kind of place or city you're going in and whether or not they're having an increase, the best thing to do is to just approach the season with preparedness, which is to make sure everyone, like yourself, your loved ones, are vaccinated. And when you do travel, it is often a good idea to wear a high quality mask when you're traveling on a plane and airports, and then take precautions perhaps when you're gathering with lots of other people.
Thank you so much. I really appreciate it.
Thank you.
Thank you.